So next up, I am so happy to introduce Gabrielle Urena and Yolanda Smith from Kaiser Permanente. Gabriella is an engagement specialist with Kaiser, and she focuses on educating employees and members about their Kaiser benefits. And Yolanda is a senior retiree solutions manager with Kaiser, and her focus is educating those aging into Medicare, focusing them on Medicare and how it works with their employer-sponsored plans. So I will turn it over to Gabriella at this point.
Thank you, Michael. And I just need a little bit of the settings to be arranged for me to share my screen again.
Oh, sure. Yeah, take your time. We're really happy to have you here today. We always love having Kaiser Permanente.
Good, I'm glad. And honestly, thank you both for such a fantastic start to the meeting. I am relaxed, I am ready to go. And
Yeah.
I think everyone on the call is too.
Yeah.
All right, can you all see my screen okay?
Yes.
All right, thank you. Well, everyone, welcome. Like he did say, I am Gabriella with Kaiser Permanente. And today, the goal of our presentation is just to share with you a little bit more detailed information about the care and wellness resources offered through your Kaiser Permanente plan. I'll also be sharing some ways that you can save time and save money, but most of all, we're really here to be a resource for you to help you understand, is this a good plan for me in my life? So let's go ahead and get started. For those of you who are a little bit unfamiliar with Kaiser Permanente as a whole and our system, I'm going to help take some time to explain that a little bit. So overall, our goal is to really help you get to your healthy place, no matter where that is. We combine both care and coverage, which makes us different than most other providers. And with this, you'll get connected care because we are both your provider and your health plan. And we're also able to access your information through our electronic medical health record. So your personal doctor, your specialists, your nurses will all be familiar and connected to you through your electronic health record system. And we'll be able to offer you personalized care because they can see your history, like your conditions, your medications, and allergies. And referrals aren't needed for all certain specialties like gynecology, mental health, and substance use disorder treatment. Just wanted to call that out. But if you do need to see another specialist, if those of you who have Kaiser might be aware, it all starts with your primary care physician so that they can connect you to the right specialist. At most of our facilities, you'll notice that you can see your primary care doctor or your specialist, get a lab, an x-ray done, and even pick up your prescriptions all in one visit, all without leaving the building. This is really we've made our facilities this way, so it's really convenient, and you can utilize as much of the services you need to in one visit. So now how do you get care? There's really a lot of different ways that you can connect to your Kaiser team, and thanks to technology, we're really able to offer you that much more options. So when you need to get care, you can have an appointment in person, as always, but you also can have an appointment over the phone or via video, and you can even email your own doctor's office with non-urgent questions. So this is really helpful, and just wanted to let you know that the telehealth visits are actually no cost to you. So if you find yourself, we've all been home a little bit more than we're used to this year, and we've actually noticed a huge increase in our telehealth services being used. But what makes us happy is that our members are still trying to get the care that they need regardless of the pandemic, and we're able to offer you that at the comfort of your own home. Now, through your kp.org account, you also have a lot of access to your own health information and how to get care. So through your kp.org account, you can schedule and cancel appointments online. You can refill most of your prescriptions, check most lab results and appointment histories, and you can even manage your bills. So these online tools are all resources that are there to help you save time and money within your day. Now, care anywhere. So this is focused on our travel care. And so no matter where you work or wherever life takes you these days, Kaiser Permanente has you covered. if something unexpected happens while you're traveling, or maybe you're just outside of your regular hometown, it's really easy to get care, and there's a few ways to connect with us to help with that. So first, you have our Away from Home travel line, which is available 24/7 to help answer any questions about your care before or after your travel. Members also can call our appointment and advice line for guidance about the type of care that's best for your situation. So if you're out of town and you feel some symptoms, but it doesn't feel completely urgent, and you're not even sure if you should go to the urgent care, if you should go to the emergency, or if maybe you just need some type of over-the-counter medication. So the advice line is there for you to give a call, talk to a registered nurse, kind of talk about the symptoms, and they'll be able to advise you on, based on this situation, it sounds like you should go to the urgent care, and this location is the closest to you. So whatever your situation is, they're going to help advise you to what you should do, and also save you a little money. That way that regularly, if you would have gone straight to the ER, the nurse would have let you know what, you could have done this at urgent care and it would have been a little bit less of the cost there comparing the two. And then finally, we have a new partnership. Or you can also, sorry, I jumped a line there. Members can also visit kp.org/travel. And that's very similar information on that page, but you can also get some common answers or answers to your questions before the trip, like refilling eligible prescriptions in preparation for your travel, or learning if you need any vaccinations if you happen to be traveling anywhere far. We know that's a little bit limited these days. And finally, I wanted to take some time to highlight our new partnership that's been with us for about a year and a half now with the Minute Clinics. So you can visit a Minute Clinic in states where Kaiser Permanente does not operate to seek urgent care with or without an appointment. Due to our partnership with Minute Clinics, members can be expected to pay for their urgent care services at the standard copay that's listed at their plan. Also, if your urgent care visit has to prescribe you medication, you're also able to use the CVS pharmacy to get that medication and still pay like you would had you gone to Kaiser. So the Minute Clinic locations are typically located in CVS and Target stores, and they're just very helpful in the sense of getting the care you need without having to deal with claims or reimbursement costs. Now, at the end of the day, no matter where you are, you always have access to emergency and urgent care worldwide. So if there's not a Minute Clinic near you, that's totally okay. Just get the care you need as soon as you need it, and as soon as things are stable, you can connect with your Kaiser Permanente team either via the travel home line, member services line, or just calling your doctor. Whatever you can do to connect with your team will get that process started to submit a claim and get the process of reimbursement started for you, so we can pay you back everything outside of what you would have paid had you gone in network. And that's a little bit of how our Care Anywhere works. Now, part of our specialty care also offers mental health services. We understand that your mind and body are connected, and we want to make sure that no matter what you're dealing with, whatever you think, you feel, or you do really affects your total health. So at Kaiser Permanente, we provide clinical and supportive services for a wide range of conditions, including anxiety, stress, depression, substance use disorder, and autism spectrum disorders. Our mental health team also includes psychiatrists, psychologists, as well as marriage and family therapists, addiction to medicine physicians, and medical social workers. As a member, you don't need a referral for any mental health care at Kaiser Permanente. So if this is something that you're interested in, I recommend visiting kp.org/mental health just to learn about the different ways that you can start accessing care, or even learn about some of the additional resources that we offer that you can utilize prior to accessing care if that's something that you would like to do instead. But I will highlight those resources a little bit further down in our presentation. Now, up next, we're going to review your plan benefits and then the additional member resources that you have access to. So this is your Kaiser Permanente Senior Advantage HMO with Part D. Now, I want to let you know that with this plan, you can see that there is no deductible, and you do have your out-of-pocket maximum for any one family member that is $1,500. Now, the out-of-pocket maximum is the most you're expected to pay for most covered services during your accumulation period. So if you get a lot of care throughout the year and you have at some point paid an accumulation of $1,500, the remainder of that accumulation period for your plan, you will be charged $0 copays for those covered services. Now, moving along with the plan, as you can see, preventative care services such as physicals, well woman exams, and screenings are covered at 100% by your plan. Now, any visits with your primary care physician, your specialist, or even if you go into urgent care services, that will all be covered at a $10 copay per visit. Now, I do want to remind you that if you take advantage of any of the telehealth services, those are all free of cost, and this copay here will only be charged when you go in person. So definitely take advantage of those if you haven't already. Moving along, labs and radiology are covered 100% by your plan and are no charge. For outpatient surgery, you have a copay of $10 per procedure. For hospitalization services, they are no charge for you, and your emergency room visits are a $25 per visit. Now, your plan also offers an allowance of $150 every 24 months for eyeglasses or contact lenses, and it also covers an allowance of $1,000 per hearing aid every 36 months. Now, for your prescription drug coverage, you do get up to a 100-day supply of any prescribed medication for a $10 copay. Now, if you take any maintenance medication, I highly recommend that you take advantage of our mail order program, that it allows you to get your medication shipped directly to your home if eligible. And not only is it convenient, but the shipping is free. So definitely take advantage of that if you take maintenance medication. And that is the top highlights of your Kaiser Permanente Senior Advantage plan. Now let's move along to the wellness resources. Now, some of the wellness resources you have access to maintain or improve your health are things like the ClassPass account, self-care digital apps, which I will explain in detail in the next few slides, and other wellness resources available to you include wellness coaching by phone, online wellness tools, and health education classes. So wellness coaching by phone is when our wellness coaches work with any member with you in this situation one-on-one by phone at no additional cost, and you get the same coach for the entire program. It's really made there for you so that if you have any health goals, any fitness goals that you have, like reducing stress or stretching more or working out a little bit more, even eating better, really it just depends on your life. You know, what is it that you're trying to achieve in your personal health? But that coach is there to help build a schedule for you, help build a plan that works for your life. And they'll be able to call you as much as you need. If you want them to check in with you every day, every other day, once a week, they are there as your coach to help you through this, help you meet that goal. And if the plan doesn't work at first, they're happy to take feedback and they'll be able to change the plan so that it really does work for you. Now, online wellness tools that we offer is where you can join a program to help you lose weight, reduce stress, quit smoking. Really, there's so many classes and programs we offer, and it's again no cost to our members. But this is more of you taking that step to see what are the classes that I think my body, my health can improve on, and what can I do to, improve. So they'll also be able to offer you video, articles, health calculators, and additional podcast recipes and more depending on what your goal is. And finally, we have health classes as well, so where you can choose from a large variety of classes and support groups and more. And they're very similar to our wellness programs, but this is more of that in-person or online setting with multiple people who are trying to learn and improve in that similar goal. So the classes that are offered do vary by location, and some may require a fee depending on the program. So just definitely check out your local facility to find out what those classes are in your area.
Now, Gabriella, are they doing on-site classes now during the pandemic?
Yeah, that's a great question. So for the most part, they've been able to migrate most of the classes online, but there are a few that they still offer in person and if not a hybrid. And they're able to offer the social distancing space, but I believe it's only classes that absolutely require more of an in-person scenario. And I believe I can't remember which ones they had mentioned that they require, which for an example, but there's only a few when I did check in with the classes wellness center.
That's great. And are any of these benefits, including the wellness coaching, is there an additional cost?
No, these are all free. The wellness program, the most of the classes are free as well. Only some of them, I believe, like if you're doing a meal program, is when the classes they'll explain to you the meals, but they're also providing meals as well as when there's a fee. So that's it's going to be things like that. But most of these wellness resources are free for our members.
That's amazing. I've
Yeah,
I've heard some Kaiser representatives in the past say that the wellness coaching by phone is fairly underutilized.
it is. It is. And I find myself presenting it every single year to all of the companies that I support, just as a reminder. But I think the biggest stigma is sometimes as a person, as a human being, just making that call or making that first step. Like, I've really been interested in this for years. Why haven't I done it yet? I hear that all the time. So it's really just being brave enough to just look at the resource online, pick up the phone and make the call. And then after that, it's there, you've done it, and the coach will then help you stay accountable. So that is a great call out, Michael. They are underutilized in most companies that I support.
Yeah, you can just write off all those past losses, just write them off and just look ahead, call up that wellness coach because it sounds like there's wellness coaches just sitting around waiting for Kaiser members to call them.
Hopefully they're staying busy somehow. But yeah, they are sitting around waiting for members.
Great.
Now, I think the last thing I wanted to touch on is that the only thing here that's listed is the reduced rates. This is the only thing that's not free out of these resources. So the reduced rates is discounted programs that we have that we offer for our members. And we actually partner with a Choose Healthy. And so the Choose Healthy program, once you go to your KP.org account under the wellness tab, it's there listed, but it offers discounts for chiropractic care, acupuncture, massage therapy, and some home gym equipment as well. So it's definitely worth taking a look at just to see what you can get with your Kaiser member discounts. And now moving along. So now I'm going to take a little deeper dive into ClassPass. This is one of our newer wellness offerings to all of our Kaiser Permanente members. And ClassPass offers at-home workouts so that you can get moving with fitness options that work for your schedule and your lifestyle. So through your ClassPass account, our members have access to over 4,000 on-demand fitness classes online, including cardio, strength training, yoga, boxing at no cost. And then in addition to the membership, once you're in the website, which I'll demonstrate after this presentation, you also get an offering to reduce rates on their live stream or in-person fitness classes like Pilates, dance, boxing from top fitness studios, and more. So to access your complimentary ClassPass account as a Kaiser member, we would start by visiting kp.org/exercise because ClassPass regularly is a paid-for application, a paid-for account, and then you would pay additional for these in-person classes and seminars that they offer. So when you do it through kp.org/exercise, you're able to get that account for free, and it renews automatically month after month, so you don't need to worry about ever having to get billed. Now, once you've set up your account, you're ready to go onto ClassPass, and you are ready to start looking at those classes and getting some exercise done for free. Now, the other new wellness resources that we've been offering to our members earlier this year is support. It's more to support a healthy mind. So with Calm and My Strength, these are applications where our members can get help navigating life's challenges by getting support to make small changes in their sleep, mood, and relationships. With both of these apps, you'll notice that small acts of self-care really have a profound impact on your overall health. So you want to download, if you want to download one or any of these apps, you want to start by visiting kp.org/self-care apps. So again, similar to ClassPass, these apps are typically paid for. So when you start by visiting kp.org/self-care apps, you are able to register for free through your Kaiser membership, and then you can log on and download the apps, or just go on the website and you can sign in. So a little bit more information about Calm. So this is what we've been providing as of May 2020, and it really is to focus on your meditation and your sleep. So for any of those who asked, how do we start improving our meditation? I think David made a great note that it is practice, it does take time, but now you also have this resource where you can start working with yourself and practicing. Something that Calm offers is that it offers you daily practice so you can focus on one activity like meditation, or incorporate a series of healthy activities such as mindfulness exercises, stretching, and sleep activities. Other features include guided meditations for both beginners and advanced meditation students, I guess, programs taught by world-renowned experts, a collection of sleep stories for both adult and children narrated by celebrity guests, and mindful movement videos and more. Now for My Strength, a little deeper dive into this wellness resource. It is also an application that you can download, and it's focused on cognitive behavioral therapy, and it is again offered at no cost. So My Strength really provides inspiration, it cultivates resilience, and it strengthens skills to build strong mental health. So some of the programs it includes is managing depression, controlling anxiety, reducing stress, practicing mindfulness and meditation, improving sleep, balancing emotions, and even managing chronic pain. I myself downloaded this at the beginning of the pandemic when it first became offered, and it's been extremely useful because I think a lot of us didn't realize the emotional impact of what the pandemic would cause, and this app kind of lets you understand yourself. You do a little quick 5-minute questionnaire, and it lets you know what, these are the topics or the areas that you should focus on for improvement, or that you are not necessarily struggling with, but that you encounter in your life. So if you ever, kind of thought about what is my mental health like, but you're not quite ready to begin looking into in-person therapy or appointments, this is a great app to just kind of take it internally and understand yourself and find out, okay, what am I working with? So again, it's free of cost, and you want to visit kp.org/selfcare apps to download this app for free as a Kaiser member. Now, a little quick update about the resources and information we have about coronavirus. So at kp.org/coronavirus, we offer frequent updates regarding the virus, including how to prevent it, what to do if you have symptoms or other concerns. On this page, you'll also find links to begin an e-visit to speak with a nurse for additional guidance on getting tested or your symptoms. And you can also connect you to a pharmacy to look into your prescriptions, make them all mail order prescriptions, and so on and so forth. It will also include some links and articles and tips about how to keep you and your family safe, and give you any updates about facilities in your area. If they were temporarily closed, they will let you know when they're open again. But at this point, most of our facilities are back and fully functioning. I think there's just a few departments that might be still temporarily closed, but like I mentioned, at this point, we're almost back to 100% being fully opened again. And I just wanted to give you a pro tip that any testing and diagnosis services related to the virus are covered at no charge to all members. So if you were a little shy about it before, just to check out kp.org/coronavirus to at least begin an e-visit about any symptoms you're feeling if you just want to get tested. The law of the land when we begin that e-visit for getting tested is that they're going to ask you if you've either experienced symptoms or if you've been in contact with somebody who's tested positive, and either of those will trigger you to be able to schedule a test. So again, there's the website on the screen, and you can learn more if it's something that you need to inquire a little bit more about. Now we are almost done with this presentation, but I just wanted to demonstrate the map of Northern California. So as you can see here, we have some different squares and circles all throughout the map. So I wanted to highlight that the squares are going to be our medical centers. The medical centers are Kaiser Permanente facilities that have your specialty care, primary care, all of the above, but also you have your hospital and emergency rooms there. So that's the difference when you're looking at the circles. The circles are medical offices, and they're still great facilities for you to use for regular care, but it's going to have primary specialty care, lab, x-ray, and all of the above, just not going to have the hospital and the emergency room. So just wanted to call that out, but as you can see, there's plenty of locations in Northern California, and we do serve a few other states. Now, thank you so much for your time and attention. I hope you found this presentation to be helpful and you learned a lot of new things about your membership or the resources offered. So now I'm going to stop sharing my screen for a brief second, just so that I can show you guys where do you go to find the ClassPass on our KP.org's account, as well as a little tech demo to what it looks like when you're there. So just give me 1 second.
And we do have 4 questions up there, and we can, I guess we can take those after the ClassPass demo.
Yeah, if there's one that's simple, maybe we can get one started while I set up, and then Yolanda, my colleague on the line, she can help me answer that so that I can just get this going for us.
Sure. A quick one is, where do you get the chiropractic discounts?
Yeah, so the link you want to save for that is kp.org/choose healthy. And that will get you to the Choose Healthy program page, where you'll be able to click the link to take you to Choose Healthy, and then you'll be able to easily look up the providers, look up the discounts and everything. Now, I do want to call out that on the Choose Healthy page, it does ask you to make a free account, and this is separate from your KP login. It's going to be a new account, so I know a lot of members go on there and type in their member login, and it doesn't work. It is a separate account, but it is free, and it just allows you to then use all the resources on that page.
So you create a separate login for that Choose Healthy account.
Exactly. Okay, so I'm about to share this screen. Let me know when you guys see it.
We can see it.
Perfect. Okay, so where I'm at right now is kp.org/exercise. And when you go onto this page, it leads you right to our fitness field. So as you can see here, it'll show you ClassPass, it'll show you what you have access to. And when you click Learn More, it's going to prompt you to log into your Kaiser Permanente account. So make sure you log in ahead of time if you'd like, or you can just click here and it'll ask you to log in. But when you log in, it's going to bring this up here. So as you can see, it'll tell you what the plan includes. And I do want to call out that both of them are free. They do have you put a credit card down, but it doesn't get charged. I myself already have an account. And what it's explaining here is the first one is the one that we have access to all throughout the year. It's those over 40,000 on-demand library of workout videos that you can use at any way you please from 5 to 75 minutes. And then the plan 2 is just going to give you a free access to a 45-day trial to those in-person or the live stream workout classes. So the live stream workout classes you'll see on the page, it's just going to be, a Zoom call where you actually have the fitness leader, the teacher, I guess. I'm spacing on the word right there, but they're gonna be conducting the class, and you're gonna be doing the workouts with them in live action. So this does give you that 45-day free trial, and once the 45 days is over, it just continues on to your regular free plan 1 option. So just wanted to call that out. It's a little bit of a hefty paragraph, but I did register as a plan 2, and I was able to try a few things out for the first 45 days, but I did not get billed the whole time, and after that when it switched. So all of that will be done on the back end, and you don't really have to worry about it. So I just wanted to call that out, but it will give you step-by-step instructions about how to download it.
So now let's, plan 2, the live streams, even if you put your credit card information in and you take the 45-day trial period, once the 45-day trial period is over, you don't start getting charged. You just revert back to plan one automatically.
Exactly. Yes. And that's why I wanted to call it out. And I think, so here we are at ClassPass. I've already logged in. So as you can see, we are at the homepage of the videos. So you can see there's partner videos, different types of programs offered. They have, I think they even post live workouts every day. So these are newer videos I haven't seen in a while. And it just has so much to choose from that, you really don't have an excuse anymore. You have any time from 5 to 30-minute videos, so just pick it, put it on your iPad, put it on your phone, and just get a little stretching or workouts done at your own pace. These people are all trained fitness experts, and if you can't do the moves like them, that's okay. With practice, with just trying, you'll get there, and it's still going to be good for your muscles and your health. Now, when we go to the home page, you're going to see it's going to show where the in-person classes are for those students that are still open near you, and you can even find live streams. So this is where it's a little bit more of a search tool for you to use, but I typically just find that the on-demand videos are just easy to just select and pick through. And that is it for my tech demo here.
Fantastic. Thank you so much for showing us the ClassPass and demoing that a little bit, because I know a lot of people have been curious about that. And we do have a number of questions to answer. So do you have the Q&A window open, or would you like me to?
Yeah. Okay, let's see.
Or do you want to go through? Why don't you go through them?
Yeah, I'll go through them. And then Yolanda, I invite you to unmute yourself so you can help me with some of these questions, particularly the first one. So the first question is, ads on TV say that senior Medicare programs offer free gym programs with some insurance plans. Does Kaiser offer that?
So in answer to that question, I hope you can hear me. Can you hear me?
Yes.
We can hear you. You're a little muffled.
Okay. In answer to the, is that better? Okay. In answer to that question, we do not include the gym membership component in the Acera retiree benefits. The only option that's available to you as a retiree of theirs at this time is the discounted membership to the gyms, as well as the free ClassPass option that's available to you at this time.
Yeah, to echo that a little louder. So we do not have the additional benefit on this senior advantage plan, but like I showed you, the ClassPass membership is free, and that's for all Kaiser members, so you do have access to that. And then when you go to the Choose Healthy programs, there's even a discounted rate for live gyms, in-person gyms. If you're comfortable with that, you can get a discounted rate where it's $25 a month for any of the gyms in your area when you search your zip code. So the ClassPass is completely free, and then the Choose Healthy program is where you'll get that discounted gym membership. So those are the two options for that.
And with the Choose Healthy program, I did search around in there and look at the gyms, and a lot of those gyms are offering online classes as well. So that would be part of the discounted program.
Exactly. Great call out, Michael. So at that point, if they're just online, you might want to save your money for a little bit, use class while it's free, and eventually when things are still a bit more comfortable to go back into the gyms in person. That's a great discount. So now I'm moving on to the next question. When can I schedule an eye exam? So if you are already a Kaiser member, you can actually schedule an eye exam anytime. But if you aren't a Kaiser member yet, you're going to wait for the plan to be effective, which I believe is February 1st, right, Michael?
Yes, February 1st for the group plans. So that would be the Kaiser Permanente Senior Advantage and the Kaiser HMO for early retirees.
Thank you for clearing that up. But with an eye exam, if you just log into your kp.org account and you schedule an appointment, you're going to notice that there's one section that says optometry appointment. And so just make an appointment that way online, or if you would rather call, you can call member services or advice appointment line and ask them to schedule you an eye exam as well. Now, how can you find out which hospital is in your area? Is the affiliated hospital. So when you visit kp.org/locations, you are able to focus us in here on Northern California or whichever region you are in. It'll show you all of our Kaiser Permanente regions. and then it'll let you know which are the closest hospitals near you that you can use. For the most part, we do have our own branded hospitals, and there's only a few cities where we have a partnered hospital or affiliated hospital. For example, in Santa Cruz County, we have a shared hospital with Watsonville Community Hospital. So they do have Kaiser Permanente doctors there and community doctors, but we've revamped the technology so that it's still very high quality care for our members. So that's what you'll notice with the map, what the affiliated locations mean. Now, the next question is, we are going to Hawaii in January. Can we get a COVID test at Kaiser before we go? Yes, you can. And what I would just recommend again is by going by to the kp.org/coronavirus website. There is a button that prompts itself right up at top that says schedule a test or begin an e-visit. Either of those buttons are the way to get started and looking into that. But like I mentioned, the rule of thumb is to either say, that you're either experiencing the symptoms or you've hung out with someone who's tested positive. Now, I know that we offer a little bit more offerings for testing, and if you speak to a nurse, just letting them know, like if you're not able to do it online, do the e-visit. When you're talking to the nurse, you can let them know, I am traveling to Hawaii and it is recommended or it is required that I have a test prior to getting there. So just having that conversation with the nurse will be able to get you scheduled. And the next question, where are the classes for exercises at reduced prices? So I believe I showed that in the tech demo. Once you're registered into ClassPass, and I think that's what we're talking about here, once you go to the homepage, it'll give you a little search tool. So you can put your zip code in and it'll tell you about the live stream classes options available to you, as well as the in-person ones if they're having a few in-person classes. And as long as you register for that plan too, you have the first 45 days to utilize that. So that's how you'll be able to find it. It's right on the homepage once you log on to ClassPass. Now the next question is, does Kaiser still have certain medicines shortage, possible to get 3 months instead of 1 month? So one thing I want to call out about the medication, especially mail order, is that they primarily do it for brand and generic drugs, and for specialty, they will just mail you up to 30 days at a time. But Yolanda, do you have anything else to add on this section?
No, that's correct what you said. So unless if the doctor orders something more, then you'll be given that, and then if they have a shortage, then they'll send it in the next.
You're breaking off a little bit towards the end.
If the doctor requests you to have a 90-day or 100-day supply, then that should be honored, and they'll figure out a way to make sure that you get that.
Yeah, so as long as you speak to your doctor, if you have any concerns that you're not getting enough, bring it up to your doctor, and then as long, like she mentioned, if they approve it, then they will honor that. And then the last question is vision included with the non-Medicare plan? I don't have the non-Medicare plan open right now. Yolanda,
No,
can you?
the answer is no. The early retirees do not have that option. They do have the option of the VSP benefit, I do believe.
Right, for the active employees, there's the additional VSP benefit, right, Michael?
Yes, VSP is one of our healthcare providers, so you can get a vision plan through VSP, and they're going to be presenting later on today at, let's see, that's going to be at noon. So yeah, you can save your vision questions for VSP.
Perfect. And it looks like we just got one last question that was sent in. What is Kaiser Hawaii doing to recruit more doctors, especially urologists, ophthalmologists, to fly out to the outer rural islands? Long story short there, it looks like that there's a lot of, you must fly to rural islands for Honolulu on the daily radiation, and just a lot of that. So specialty care. Yolanda, do you have any tips about care in Hawaii?
My response to that would be you would have to check in with that service area, that member services area, to determine what they're trying to do to further outreach in those areas. We don't have any updates on that?
Okay, to reiterate a little bit, we do not have that information with us. We do have to check in with the service areas to inquire a little bit more about what are they doing to reach out to that problem. But sometimes letting us know, it helps. Thank you for letting us know, because we're able to note it and send it up and our way, so that, you know, all of these number feedback eventually makes changes in our facility. So thank you for sharing.
And there is one more question. If I move to Senior Advantage, will I be able to also pay for VSP through Acera? And the answer is yes. You can be Kaiser Permanente Senior Advantage and pay for the VSP plan. And in fact, if you have at least 10 years of service credit, the VSP plan, the standard plan, doesn't cost you anything.
Perfect. Thank you for taking that, Michael.
Sure. So I think that concludes our time with Kaiser. Thank you so much, Gabriella and Yolanda. Kaiser benefits are extensive and powerful. I mean, they're amazing. So thank you for delving into them, and thank you for being here with us and answering the questions for all of our Acera members. You always support us greatly, so thank you.
Yeah, thank you for having us. And we'll stay on for a little bit, but hopefully we'll see some of you guys at the office hours at 1.
Sure. So, and I just want to remind everyone, since we're talking about Kaiser, Kaiser Permanente is offering office hours today, starting at 1 o'clock. And the way to access that is to go to the health fair page, which is www.acera.org/healthfair, and go under the Kaiser the Kaiser icon, the Kaiser logo, and there's a link there for the open office hours, and you can sign up for open office hours today only. And then after that, if you have any other more questions for Kaiser, then you can contact Kaiser directly.